I chose a career in medicine because that's really all I ever wanted to do. I was unusual in that, more than that, I wanted to be an orthopedic surgeon from about the age of 10. And I think it goes back to my mother, because she was born with a congenital problem in her hip that meant she got arthritis at a very young age. And I remember going to see her in Wrightington Hospital on the night after she'd had her hip replaced, and she would have only been about 40 years old when she had that done. And she was there with the drips up and with the drains in and the big dressing on her leg. And I remember asking her how it was, and she said it was fantastic, because for the first time in 15 years she couldn't feel any pain in her hip. And I remember thinking at the time, if you can do that to someone and they can be that happy within hours of you doing it, then that's a really good thing to do, and I quite like to do that. I went to medical school in Liverpool. I qualified in 1986, and very quickly I moved to Nottingham. Nottingham at that time had, well, still has, an excellent reputation for orthopedics and for training in particular, and so I chose to go there, and I spent the best part of 12 years in Nottingham. Started off with some junior surgical jobs, and then I did a period of research, and then I actually completed all my orthopedic training in Nottingham, and that culminated in my consultant appointment in 1998. My research followed on from my first job in Nottingham, because while I was in Nottingham, there was a plane crashed on the M1 at Kegworth in 1989, and there were a lot of seriously ill, injured passengers, and they were taken to Queen's Medical Centre amongst two other hospitals for treatment. I was one of the junior doctors, and I was involved in their treatment. From that crash there spawned a research project, and that culminated in my research project, which was to devise the best brace position for passengers to adopt if a plane is about to crash. And I submitted that as my doctoral thesis, and the position that was devised is the one that is displayed on passenger safety cards on planes that fly out of the United Kingdom. I chose a shoulder surgery partly because my mentor in Nottingham was Professor Angus Wallace, and that was his specialty area of interest. And I became interested in shoulders because it was a rapidly expanding specialty. If we look at where shoulder surgery has come in the last 30 years, it's an enormous journey. Initially, every orthopedic complaint was a frozen shoulder, but more recently, because of MRI scans, because of keyhole surgery, we now have a multitude of diagnoses, and by having different diagnoses we can offer different treatments, and so shoulder surgery is still a very rapidly expanding dynamic specialty, which makes it a very exciting one to work in. My proudest achievements in my career probably relate to the acknowledgement I've received from my colleagues and from my patients. And in saying that, I mean, in the early days I established a name for being at the forefront of the sort of keyhole shoulder surgery techniques, and that was recognized by my colleagues in Europe and in the United States, in that I was invited to do live surgical demonstrations in Europe and in the United States. And to invite someone to operate in your theatre, in your domain, but out of their domain, shows a degree of confidence and trust in that individual that I found very flattering. So I guess I'm proud of that. I'm proud of the recognition I've received from patients, in that people seem to want to come and be treated by me. I guess at the extreme, that would be that the elite athletes. I've had the privilege of being the upper limb surgeon to Liverpool Football Club for over 10 years now, and during that time I've treated quite a large number of elite athletes, particularly footballers, and not just from Liverpool. I've treated them from 5 or 6 other Premiership football clubs, and where you've got elite athletes, clubs in particular are very careful who they send those players to, and for a player to be sent to me from another part of Britain, which realistically is not an uncommon occurrence, shows a degree of confidence in my abilities that I find, again, flattering and comforting. I am the managing partner of the Bone and Joint Centre. I think the Bone and Joint Centre has been almost revolutionary in this country in terms of offering a complete service, but with the tenet that there was a governance structure in to ensure the highest quality standards of care. And I think that's a model that will be repeated as time goes by and duplicated, because I think it's the best model by which to supply healthcare. So in the Bone and Joint Centre I have two roles. I have a role as an orthopaedic surgeon and a specialist in shoulder and elbow problems. But in addition, I have been the managing partner of the Bone and Joint Centre since its inception, which has been interesting because it has required me to take on somewhat of a managerial or administrative role, and there are challenges to be met when you have to help manage orthopedic surgeons, particularly a group of 9, because they all tend to be relatively strong-willed individuals, and so to achieve consensus going forward is sometimes difficult. But I've enjoyed that. It's been a different aspect to my life, and I still enjoy it to this day, which is probably why I'm still doing the job.